Well, roughly 500,000 Coloradans were removed from Medicaid coverage at the end of the pandemic. But what is clear, according to the Colorado Health Foundation, is that it's been very tough on many people and tough on the state economy. Denver 7's Colette Bordelon explains why some people say there is a possible solution, but it's actually also a problem.
This Thornton Hospital is exactly where Dr. Kristen Fittis wants to be.
I went and worked in critical care when I first graduated and did that for 15 years. I loved being a bedside nurse. Yeah.
Now she's been in healthcare for almost 25 years and is the chief nursing officer here at HCA Health One Mountain Ridge.
We have to be able to take care of everyone, regardless of their ability to pay for it.
She's concerned about a bill working its way through the state capitol.
We're in this situation to begin with because Colorado mismanaged Medicaid in the first place.
Something she says stems from the state's Medicaid unwind, which happened between 2023 and 24, when 1.8 million Coloradans covered by Medicaid were reviewed after the COVID-19 public health emergency came to an end.
They essentially doubled the amount of uninsured in the state of Colorado in like one fell swoop, really.
I think many people nationally looked at Colorado and thought we did this pretty poorly.
State Representative Kyle Brown is sponsoring House Bill 1174.
This bill is about creating sustainable funding for the safety net providers that got hurt the most in the unwind. Safety net providers are those that provide health care to the most vulnerable, to low-income folks, right? They do not have sources of commercial insurance. They are reliant upon Medicaid predominantly.
Essentially, the bill would place a cap on how much money can be reimbursed to hospitals for treating patients on the state's health insurance plan.
I think it's important to remember that the hospital industry is a $22 billion industry in Colorado.
The money the state saves would go to community health centers. Brown says those have struggled the most since the end of the pandemic.
The impression that hospitals just make a ton of money is just not accurate in most cases.
Dr. Jim Caldwell is the chief medical officer at UC Health Parkview Hospital in Pueblo, who says the rate caps could be catastrophic.
Coming out of COVID, it was incredibly devastating to our bottom line. It's also just the wrong time for this because we have a potential $800 billion on the table in federal Medicaid cuts.
Back in Thornton, Dr. Fittis believes the bill will impact patient care.
What you pay out of pocket for your insurance is going to go up. Your ER wait times get longer.
Saying this bill hurts what hospitals are here to do.
It is very much a Band-Aid solution to a much bigger problem.
Colette Bordelon, Denver 7.
And the bill has an exemption for rural and small hospitals. We received a statement from the governor's office on this. It says, as Congress and Donald Trump attack our healthcare system and providers, our rural hospitals, safety net providers, and federally qualified health centers are especially vulnerable. This bill provides a lifeline to these important rural and safety net providers that Coloradans rely on every day for essential health care.